ಆಗಮಿಸಿದ ತಮಗೆಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮ ಶುರು ಮಾಡೋಣ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ ಮೂಲಕ ಎಲ್ಲರೂ ಕನ್ನಡ ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆಮೆಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. ಧ್ವಜವಂದನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರ ಧ್ವಜವನ್ನು ವಂದಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮಗೆ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಮಾನ್ಯತೆ ಪಡೆದಿರುವ ರಾಷ್ಟ್ರ ಸಂಸ್ಥೆಯ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ನಮ್ಮ ರಾಜನಿಷ್ಠೆಯ ಶಪಥ ಮಾಡುತ್ತಿದ್ದೇವೆ. ನಮ್ಮ ರಾಷ್ಟ್ರ ಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯವಾಗಿರಲಿ. ವಂದನೆಗಳು.
I request our chairman, Dr. Suresh Kagalkar, to welcome. Dr. Kagalkar, you are there?
Professor, please unmute and speak.
Sir, you have to unmute yourself.
ಪ್ರಸಾದ್, ಮೊದಲು ನಮ್ಮ ಪ್ರೆಸಿಡೆಂಟ್ ಹತ್ರ ಮಾತಾಡ್ಸ್ಬಿಡಿ.
ಅಲ್ಲ, ಇವ್ರು ಆದ್ಮೇಲೆ ಅವ್ರ ಇನಾಗ್ರೇಷನ್.
Suresh sir,
ಸ್ವಲ್ಪ ಓಪನಿಂಗ್ ರಿಮಾರ್ಕ್ಸ್ ನೀವು ಹೇಳಿ, then we'll take over.
thank you sir. ಅನುರಾಧ ಮೇಡಮ್ ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ. ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಅನುರಾಧ ಮೇಡಮ್,
ಥ್ಯಾಂಕ್ ಯು.
ಸೂರ್ಯರಾಜ್ ಸರ್, ಎಸ್, ಸೂರ್ಯರಾಜ್ ಅವರು ಬಂದಿದ್ದಾರೆ. ಎಸ್, ಥ್ಯಾಂಕ್ ಯು. ವೀಣಾ ಕೋರಿ ಮೇಡಮ್ ಕೂಡ ಬಂದಿದ್ದಾರೆ. ಸುರೇಶ್ ಸರ್, ನಿಮ್ಮ ಓಪನಿಂಗ್ ರಿಮಾರ್ಕ್ಸ್ ಸರ್, ನಿಮ್ದು ವೆಲ್ಕಮ್. ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ ಸರ್.
ಮಾಡಿ ಆಗ್ಲೇ ಇದಾಯ್ತಲ್ಲ.
ವೆಲ್ಕಮ್ ಸ್ಪೀಚ್. ವೆಲ್ಕಮ್ ಮಾಡಿ.
ವೆಲ್ಕಮ್ ಸ್ಪೀಚ್ ಸರ್ ನಿಮ್ದು. Good evening, everyone. On the behalf of IMA Public Health Committee, we are welcoming all the dignitaries for this today's function, and all the office bearers also. I heartily welcome to today's important the first session of the public health program. As all of you know, this is an important topic which we are going to cover in this session. That is, there are the two big named speakers who are well versed with their own in their medical field, as well as they are known figure in the all over country. So with this, let us, especially the junior doctors and internees, especially the new coming budding doctors, let us have the opinion and the different suggestions. Welcome for this today's function. As we know, 75% of the doctors in India, they are facing the violence in the working place. It is mainly because of lack of proper knowledge about the act, as well as insurance coverage, and ignorance. We cannot say that it is ignorance. It is our duty to know the every important steps of the rule, that is KPMA Act. So the KPMA Act and the rule is very important. Every doctor, before practicing, after completion of their degree, he has to understand the each and every steps of the line of the system, that is KPMA rule. So with this, I welcome our beloved President Dr. Chiniwala sir for today's function. Sir, please welcome to today's program, sir. Chiniwala sir. Second, I welcome our Honorary Secretary Dr. Suri Raju sir for today's the function. So already, and also I thanks to Suri Raju sir. He has done the IMA prayer and flag salutation, sir. And I welcome today's the guest speaker, Dr. Kumbar sir from the Hubli. So he's a advocate as well as IMA member, senior IMA member, and well-known figure. And is every conference, his one topic will be there. So every doctor eager to speak, eager to listen his speech. Secondly, I welcome Dr. Madhusudan sir. He is also known figure, and everybody knows, no need much introduction. I welcome sir. And also I welcome all the our members of the Public Health Committee, as well as our today's the moderator, Dr. Rajendra Prasad sir. I welcome, and he is the person who started this program mainly because he has selected the good topic as well as good speaker. So this first program is going to be very much highlighted, and we'll learn a lot of things from everybody. And also I welcome all the members, all the office bearers, as well as our past president, as well as the different the wings of the IMA KSB. So everybody I welcome once again for today's function. And if anybody I left, I forgive, pardon, and we'll make a good program with all your suggestions and comments. Let us start the program. Dr. Rajendra Prasad will introduce the different our members, Jayalakshmi, as well as Dr. Anuradha, who is going to give a small brief introduction about the today's speakers. Dr. Rajan sir.
I request our President, Dr. Chinivalar, IMA KSP
Yeah.
President, to inaugurate the program, sir.
Yeah, Dr. Chinivala sir, before starting, please.
ಸೊ ಇಂದಿನ ಕೇಳ್ತಾ ಇದೆಯಲ್ಲ?
Yes, sir.
ಕೇಳ್ತಾ ಇದೆ.
Yes, sir.
ಕೇಳುತ್ತೆ ಸರ್, ಹೇಳಿ.
ಇಂದಿನ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಫೋರಮ್ ಒಂದು ಒಳ್ಳೆಯ ಒಂದು ಟಾಪಿಕ್ ನ ಚೂಸ್ ಮಾಡಿದ್ದೀರಿ. ಸೊ ಈ ಒಂದು ಪ್ರೋಗ್ರಾಮಿಗೆ ಪಬ್ಲಿಕ್ ಸ್ಪೀಕರ್ಸ್ ಆಗಿ ಒಳ್ಳೆಯ ನಮ್ಮ ಲಾಯರ್ ಕಮ್ ಅನಸ್ಥೆಟಿಸ್ಟ್ ಆದಂಥ ಡಾಕ್ಟರ್ ಕುಂಬಾರ್ ಅವರು ಮತ್ತು ನಮ್ಮ ಹಿಂದಿನ ರಾಜ್ಯಾಧ್ಯಕ್ಷರಾದಂಥ ಡಾಕ್ಟರ್ ಮಧುಸೂದನ್ ಕಾರಿಂಗ್ನವರು ಬಂದಿದ್ದಾರೆ. ಒಳ್ಳೆ ಟಾಪಿಕ್ ಇದಾವೆ. ಆಕ್ಚುಲಿ ಪ್ರತಿಯೊಬ್ಬ ವೈದ್ಯರು ತಮ್ಮ ಜೀವನದಲ್ಲಿ ಕನಿಷ್ಠ ಏನಿಲ್ಲ ಅಂದ್ರೆ 70 ರಿಂದ 75% ಡಾಕ್ಟರ್ಸು ಒಂದಿಲ್ಲ ಒಂದು ಹಲ್ಲೆಗಳಾಗಲಿ ಅಲಿಗೇಷನ್ಸ್ ಆಗಲಿ ಅವರ ಜೀವನದಲ್ಲಿ ನಡೆದು ಹೋಗಿರ್ತವೆ. ಸೊ ಇಂಥವನ್ನ ಹೇಗೆ ನಾವು ಏನಂತಲ್ಲ ನಮ್ಮ ಜೀವನದಲ್ಲಿ ಏನಂತ ಫೇಸ್ ಮಾಡಬೇಕು, ಎದುರಿಸಬೇಕು ಎಂಬುದ್ರ ಬಗ್ಗೆ ಏನಂತಲ್ಲ ಡಾಕ್ಟರ್ ಕುಂಬಾರ್ ಅವರು ಅದರ ಬಗ್ಗೆ ಮಾಹಿತಿ ನೀಡುತ್ತಾರೆ. ನಂತರ ನಮ್ಮ ಒಂದು ವೃತ್ತಿಯಲ್ಲಿ ಪ್ರೊಫೆಷನಲ್ಲಿ ಏನಾದರೂ ತೊಂದರೆಗಳಾದಾಗ ಅವುಗಳಿಗೆ ಏನಂತಲ್ಲ ನಮ್ಮ ವೃತ್ತಿಗೆ ಒಂದು ಸುರಕ್ಷತೆ ಭದ್ರತೆ ಕೊಡುವುದರ ಸಲುವಾಗಿ ನಮ್ಮ ಕರ್ನಾಟಕ ರಾಜ್ಯದ ಏನಂತಲ್ಲ IMA ಇದೆ, ಪ್ರೊಫೆಷನಲ್ ಪ್ರೊಟೆಕ್ಷನ್ ಸ್ಕೀಮ್ ಅಂತ ಇದೆ. ಅದರ ಮೂಲಕ ಏನಂತಲ್ಲ ಯಾವ ರೀತಿ ನಾವು ಪ್ರೊಟೆಕ್ಷನ್ ತಗೋಬಹುದು, ಎಷ್ಟು ಪ್ರೀಮಿಯಂ ಇದೆ, ಅದ್ರ ಬಗ್ಗೆ ಸವಿಸ್ತರವಾಗಿ ಡಾಕ್ಟರ್ ಮಧುಸೂದನ್ ಕಾರಿಂಗ್ನವರು ಹೇಳ್ತಾರೆ. ಸೊ ಇದು ಒಂದು ಏನಂದ್ರೆ ಈ ಒಂದು ಇದಕ್ಕ ನಮ್ಮ ಎಂಟ್ರನ್ಸ್ ಸತಿಗೆ ಬಂದಿದ್ದು ಬಹಳ ಒಳ್ಳೆಯದು. ಯಾಕಂದ್ರೆ ನಾವು ನಡುವೆ ಯಾರೋ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ, ದಯವಿಟ್ಟು ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಳಿ. ದಯವಿಟ್ಟು ಎಲ್ಲರೂ ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಳಿ ಅಂದ್ರೆ ನಾನು ಕೇಳುತ್ತೆ. ಸೊ MBBS ಓದೋ ಟೈಮಿನಲ್ಲಿ ನಮಗೆ ಕಮ್ಯುನಿಕೇಶನ್ ಸ್ಕಿಲ್ಲು, ಕೌನ್ಸಿಲಿಂಗ್ ಬಗ್ಗೆ ಯಾರು ತಿಳಿಸಿ ಹೇಳಿಕೊಟ್ಟಿರೋದಲ್ಲ. ಸರ್ಜರಿ, ಗೈನಕೋ, ಮೆಡಿಸಿನ್ ಬಗ್ಗೆ ಎಲ್ಲ ಕಲಿಸಿರ್ತಾರೆ, ಕಮ್ಯುನಿಕೇಶನ್ ಸ್ಕಿಲ್ ಹೇಳಿರೋದಿಲ್ಲ. ಸೊ ಇದು ನಾವು ಯಾವಾಗ ನಮ್ಮ ಪ್ರಾಕ್ಟೀಸ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದಾಗ ನಮ್ಮ ಅನುಭವದ ಮೇಲೆ ನಮಗೆ ಇದು ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಇಂತಹ ಅನುಭವಗಳದು ಏನೈತಲ್ಲ ಇದ್ರ ಬಗ್ಗೆ ಈಗ ವಿಸ್ತಾರವಾಗಿ ಶಿವಕುಮಾರ್ ಕುಂಬಾರ್ ಅವರು ತಿಳಿಸಿಕೊಡ್ತಾರೆ. ಅದರಂತ ಹೇಳಿ ನಾನು ಇಂದಿನ ಒಂದು ಈ ಪ್ರೋಗ್ರಾಮ್ ಅನ್ನು ಉದ್ಘಾಟನೆ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ದಯವಿಟ್ಟು ಏನಂತಲ್ಲ ಮುಂದುವರಿಸಲಿ ಅಂತ ಹೇಳಿ ಕೇಳ್ಕೊಳ್ತಾ ಇದ್ದೀನಿ.
Thank you, sir. Thank you, Chinivala sir. Let us continue with our today's important program. Rajan sir, please continue.
Sir, I request Dr. Rohini to introduce our guest speaker, Professor Dr. Shivakumar Kumbar.
Dr. Rohini, madam.
Yes, sir.
Yeah.
Sir, I want the slide to be there. Can I see the slide, sir?
Yeah, madam.
I'm honored and good evening, everyone. I'm honored and privileged to introduce today's speaker, Professor Dr. Shivakumar Kumbar, sir. Sir is a consultant anesthesiologist and a medico-legal advisor and a pain and palliative care therapist, member of a mediation cell, Dharwad District Consumer Court, medical journalist, sexual medicine therapist. Sir has done a graduation from MR Medical College, Gulbarga, and a post-graduation from KIMS Hubli. Sir has also done an LLB, LLM, MBA in hospital administration, Masters in journalism from Mysore University. He holds a post-graduation diploma degree in medico-legal systems, medical law and ethics. Sir is a fellow of Indian Academy of Medical Specialties. And Sir was the International Chair, UNESCO Bioethics and Human Rights in 2022. Sir has served as a Vice President of IMA Karnataka State in 2016-17. He also served as a Chairman IMA AMS Karnataka State 2022. He was the President of the Indian Society of Anesthesiologists Karnataka in 2023-24. Sir is a Honorable Professor of IMA National Academy of Medical Specialties in 2022. He is a member of a standing committee of a legal cell, rural health and ethics. So with this, today Sir is going to speak to us about medical negligence cases and documentation. We are eager to hear to you, Sir. Over to you, Sir, now.
Thank you,
Yeah.
Rohini madam.
Yeah, shall I continue?
Yes, sir. Shivakumar sir, please.
Yeah,
Please, sir.
yeah, hold on. Yeah.
Yeah, sir, before that, I have an announcement.
Sound.
Sir, request all participants not to draw on the screen, sir. Someone is drawing on the screen. Please request all the participants not to draw anything on the screen.
Yeah.
Okay, sir.
Yeah. Yeah, good evening, everyone. Respected President Chinmal sir, Secretary Suryo, and past President Dr. Madhusudan, and rest of the members. Thank you very much for giving me an opportunity to share my views on medical record keeping and medical legal issues. I thank Dr. Rohini for the brief introduction. I also thank other coordinators for this wonderful program. I also thank Dr. Suresh as well as the Dr. Ajendra Prajaz who are the instrumental for this webinar. Yeah. Friends, before I deal into this medical records and the medical negligence, this is a very famous quote. I am very close to this. Nothing is more devastating to an innocent physician's defense against the allegations of medical malpractice than an inaccurate, illegible, or skimpy medical record. Okay. Yeah. Friends, many times we do come across medical records mistakes which can be considered as a deficiency in the service as well as the medical negligence per se. Many times I do come across the judiciary reads in between the lines whatever you write, and many times if you take it very lightly, you are accountable in consumer fora, criminal negligence, and the respective state medical councils also. So definitely is going to guard the doctors about the medical negligence litigations, and also helps in the scientific evaluation of their patient profile, helps in analyzing the treatment results and plan for the further protocols, helps the government for future strategies, helps in sentencing or acquittal of the doctors. Many times we have come across these cases. The very peculiar history about the medical history. The earliest document of the medical records in India is found in Atharva Veda, wherein an astrologer, Horrendous Dr. Farman, recorded more than 10,000 consultations between 1596 and 1603, and since then it progressed step by step, and present day era we are seeing it as a science in a medical specialty itself. So what exactly is the medical record? I would say that it is a legal document providing a chronicle of a patient's medical history and the care given by the physician. So what medical records include? Documents of the patient's history, clinical findings, diagnostic tests, pre-op, intra-op, post-operative notes, medications, pharmacy records, billing of the patients, bill what is paid, and also the consent for which procedure you have given a consent, and also every prescription in the eyes of the law is a medical record. And also, whenever you refer a patient to higher centers, that also accounts to the medical records. If at all you are advising any patient on phone, that also amounts to the medical records. So the analysis of the National Consumer Dispute Redressal forum about the medical records, 37% of the entries in the case paper are missed entries. So most common is doctor's signature is missing, PA is missing, post-operative notes are missing, and diagnosis, they have taken it a very casual attitude or a mechanical fashion. Cases with lacunae in the medical records, they found that 37.29% okay, of these cases are exclusively on the medical record negligences. So, what are the lacunae in medical records? I would say that 15% of them will be the missed entry in the medical records, and 8.2% is the deficient in the consent form, and missing records because page-wise they don't consider it, and many times after 6 months we don't find half of the case paper itself, and deficient in discharge summary, which is very, very important, and errors in the entry because they are not entered in a chronological order. Whatever the sisters' notes are there, they are not matching with the doctor's notes, and many times we see that wrong reporting, which we don't consider legally, and the tampering with the records is also very, very common. This is a report done by the National Consumer Redressal Forum. Methods of the record keeping, it's very, very important. Even in India, 90% of the medical record keeping is manual or a paper or books. So there are some limitations of this record keeping. Large storage area is required. There are difficulties in the retrieval of the records, but it is legally more acceptable as a documentary evidence as it is difficult to tamper with the records without detection. Even in the courts or judiciary, even in any of the fora, even in the police station, they accept the medical records written, unlike other countries who are not very well versed with the computerization of the electronic records. So computerization of the records, these are very neat, no doubt about it, tidy, easily stored and retrieved. But possibility of easy manipulation without detection is a serious concern. So hence, they may not be universally accepted at a face value as a documentary evidence. Also, maintaining the confidentiality of the patient records is very, very challenging, especially in this computer era, because day in and out we do come across the cyber crimes. Probably it's a very dangerous thing. We have to tide over this, then only it is authentical. So what are the importance of medical records? When we talk about the medical records, we have 5 arms, I would say. First, for the patient, documentation of the clinical history, continuity of the treatment. It helps in claiming the insurances, issue of medical certificates, and it is accepted as a legal evidence in the court of law. Then for the doctor, medical review of treatment, every stepwise, or even if the patient comes after 5 years or 10 years, you have a record it, even the patient has not forgotten it, what he had, doctors also must have forgotten it, but records will speak the truth. And it also helps in the research and training, education, training, clinical, epidemiological research, and health system research. So the health status of any country depends upon the accuracy of the medical record keeping in the respect to hospitals or in the clinical. Coming to the hospital, how exactly it's important, the quality, quantity, and adequacy of the treatment, we'll come to know about that. Medical audit is very, very important, and administration and management of the medical legal protection, and also disease surveillance and epidemiological studies are done only with the medical records, not otherwise. Medical legally, for claiming insurance and tax benefits, malpractices and negligence cases, and its safeguards as evidence in the court of law, either from the doctor or from the hospital. Certificates of the birth and deaths, very, very important. Certificate of the mental status of the patient, certification of the invalid pension, and also Right to Information Act and CPA, including the criminal laws. So what are the categories of the medical records? Records that are given to the patient as a matter of right, because patient has the right to take whatever you have not given, especially discharge summary, because having admitted the patient, having paid the bill at the hospital, you cannot decline about the discharge summary. And also death summary, discharge and medical advice, which I am going to deal with the next slide. Records that are given to the patient after patient are authorized attendance fulfill due requirement as stipulated by the hospital. especially hospital bills. Okay, and the records that are not to be given without the direction of the court, especially medical legal cases or the autopsy reports. So types of medical records I just categorize in 2-3 events. Records directly relate to the patient management. I said you the OPD, IPD, diagnostic tests, and medical legal cases pertaining to the patient management only. Records not directly relate to the patient management but are necessary to keep in the hospital, especially administrative records, records on the PCPNDT Act, MTP Act, biomedical waste, organ transplant, as well as the KPME rules and regulations. So many times we take this discharge notes as a very casual or a mechanical way. That's how we'll end up in the medical legal issues. With the crucial piece of the evidence regarding the IPD treatment of the patient, no doubt about it, it should include follow-up orders also. If the patient does not follow, something happens. It is a contributory negligence or a total negligence on the part of the patient. Discharge card should be signed or countersigned by the consultant. Unless he signs, it has no legal sanctity. He cannot claim that what I have written is the right on my part unless he signs it. A copy of it should be preserved with the case paper, because many times patient after 2 or 3 years they would say that I paid hospital but the doctor failed to give me a discharge card even though I insisted for that. So best to have a copy of it along with the case paper. Discrepancy in the discharge card and what is kept in hospital records can cause suspicion about the tampering with the medical records. I have come across many cases. There are some discrepancies in the discharge card. When the judiciary went back in between the lines of the case paper, there are a lot of discrepancy between the sister's notes, doctor's notes, including the discharge notes. So the onus falls on the doctor to prove that it is very, very difficult. And ultimately, the patient has a right edge over the rest of the things. This should be avoided at all costs, as the benefit of this usually goes in favor of the patient in the eyes of the law. So discharge against medical advice. I have come across wherein doctors are refused to give the case paper or discharge card stating that he is going against the medical advice. Friends, this is not true. These patients are entitled to have a discharge summary as long as they have stayed in the hospital. It is imperative to record all its implications and should be signed by the patient or related to a doctor and duly witnessed, because you must tell the patient or the patient attendants the pros and cons of getting discharged against the medical advice, and it has to be written and it should be signed and witnessed. Retain a copy of this along with the IPD case paper also. Otherwise, he would claim afterwards that I never knew that so and so is happening, and that took it very casually and they asked me to get out of the hospital, which shouldn't be there. It helps whenever there is a litigation in a later period. I will come to the next slide, how long they can last. So coming to the referral notes, it is also very, very important. It is also important component of the medical records. We should not forget about it. Whenever you refer a patient to the tertiary care center, higher center, or to your counterpart for the best medical availability, make sure that date, time, and patient condition. Reason for referrals is also very, very important. It is wise to keep the duplicate copy of their referral note with the patient's signature tagged with the case paper, because afterwards there are incidents wherein the patient and relatives went to the court, even in the consumer court, stating that doctor referred the patient to the tertiary care center very late. So actually, it was the mistake on the part of the patient relative. You are referred to some other hospital, he went to another 2-3 hospital. By the time he goes to the tertiary care center, probably patient condition would have been worsened. That time, he has the only way to go against the doctor stating that doctor did not refer the patient in time. So they landed up with the problems. So in this case, it is very, very important. You have to write the time, date, condition of the patient. That is very, very important. So as long as the patient till the tertiary care center, the responsibility lies with the referring doctor or the referring hospital. Make sure that the beds are available in the tertiary care center or wherever you are referring, and patient reaches or patient is handed over their tertiary care center, then only your liability ends. Otherwise, you are liable for that. So confidentiality of the medical records. Yes, can be used as a personal document. This information is very, very confidential and should not be released without the consent of the patient except in specific situations. This is called as a personal document. Hospital legally bound to maintain confidentiality of the patient or patient's medical records. Patient can sue a doctor or hospital for breach of confidentiality, which is very, very, very important. Ethically is important, legally is important, and you are accountable for that. Then the impersonal document. Here, record loses its identity as a personal document, and the patient's permission to release the patient's whatever there in the case paper is not required, especially during a referral, when demanded by the court or the police on a written request, when demanded by the insurance companies where patient has relinquished his rights to on taking the insurance, when demanded for the specific provisions of the Workmen's Compensation Act and higher authorities. That time it is called as impersonal document. Then who is the owner of the medical records? There is a long debate. Ultimately, by and large, the medical records are the property of the hospital, and it is the responsibility of the hospital to maintain it properly. How exactly we should maintain? There are set protocols given by the WHO, how exactly records should be maintained in the hospital where the patient has undergone a treatment. Hospital and doctors should see that documents are not stolen by unscrupulous people, they are not manipulated or misused for malafide intentions by any other interested third parties, because hospital play a very vital role in the record keeping. Is it obligatory for the hospital to provide a copy of the case paper or record to the patient when it is demanded? Yes, it is obligatory for the doctors and hospital to provide a copy of the case record, medical record of the patient or his legal representative. It is his right. That's what I said you. So, how long you can keep, and what is the rationale and Medical Council of India guidelines? So, Medical Council of India in section 1.3.1 and appendix 3 maintain the records of the IPD in a standard pro forma for 3 years from the commencement of the treatment. It talks only about the IPD, but it is not bothered to talk about the OPD. Section 1.3.2, request for a medical records by the patient or the authorized attendant should be acknowledged. A document should be issued within 72 hours. But as per the NMC rules and regulations, yes, patient can claim or get the document from the hospital within 5 working days and is yet to come. As per section 1.3.3, maintain register of the certificate with full details issued with at least one identification mark of the patient and his signature, and have a copy of it in the hospital. All efforts should be made to computerize the medical records for quick retrieval. This is in the Medical Council of India, but this facility is not very much come forward in the era of digitalization, but still a lot many things have to be done, because most of the rural people are not computer savvy. It is lacking behind, I would say. How long should the medical records be preserved? As per the Indian Limitation Act 1963 and Section 24 of the Consumer Protection Act 2019, 2 years for the OPD and 3 years for the IPD. However, the provision of the CPA allows for condoning the delay in appropriate cases. I have come across such cases. It is the discretion of the consumer for whether to accept it or not to accept it. There are some cases the doctor said that doctor has come to the judiciary even though he has taken treatment after 4 or 5 years. If the judiciary is a bit lenient towards the patient, and if the patient convinces why he was delayed, so it has the discretionary power even to allow the conviction delay. Pediatric cases, yes, records have to be maintained for 21 years. As per the Indian Majority Act, 18 years the majority, plus he has a right to claim anything after 3 years is totally 21 years. And Medical Council of India, IPD, I told you it's 3 years. MLC records still final disposal of case, even though only complaint or a notice is served. It is the right to keep these medical records preserved till the case is disposed of in medical legal cases. Especially it happens in the orthopedic cases. Then PCPNDT Act, Section 29 speak about that. We have to have these preserved records for 2 years. And the central government, okay, Director of Health Services, OPD 5 years, IPD 10 years, medical cases 10 years, and income tax, it asks the doctors to keep it for 7 years. These SOP, there are some SOPs, and it all depends upon the individual state also. Few states, they have their own SOPs, how long to preserve. So in India, we don't have a centralized process of preserving records of the patient, which we need to be done, because different states have different guidelines. So it is not matching with the Medical Council of India guidelines. So how to destroy the medical records? This is very, very important. Give a public notice in one English and one vernacular newspaper with a time limit of usually 1 month from the date of publication, in which anyone who wants the relevant case paper can come and take a copy of the record needed, and we can number it from so and so number to so and so. Case papers are being destroyed. So if anybody wants for any other purpose, they can come and pay the reasonable amount of fee or hospital fees and get the copy of it done. After 1 month, they destroy the copy of case paper which are already published in the paper, except where litigation is going on. Notice of pre-litigation is served. Only a lawyer notice is being served. So we cannot throw away or destroy the case papers. Mentally ill or retarded patients, where we expect that there will be a future trouble, that has to be preserved. Is a doctor obliged to give a records under the Right to Information Act 2005? A private doctor is not covered by the Right to Information Act 2005. Doctors in public sector must seek permission or a special consent of the patient before giving records under Right to Information Act. So this, many people have asked me, this is my answer to them. So summoning a medical records by the court, this is also very, very important. As per the Indian Evidence Act, what I said, medical records are accepted as evidence. Erasing of entries is not at all permitted and is questionable in the court of law. In the event of correctness, make sure that the entire line is scored and rewritten with the date and time. As I rightly said, the judiciary reads in between the lines. Records are summoned in the court of law in the following conditions, especially the criminal cases, RTA, Road Traffic Accident, under Motor Vehicular Act for deciding the amount of compensation, labor courts in relation to the workman compensation, insurance company, CPA, and so many things. I'll finish in another 5 minutes. And what is an ideal medical record? The medical record should be clean, complete, chronologically written. It has to be comprehensive, and it should be correct without any manipulations or overwriting, which hints tampering of the records even in the public eyes. There are some cases wherein not maintaining the proper medical records, there are deficient negligence on the part of the doctor. Even Dr. Kunal Shah, everybody aware of it, Dr. Sukhmar Mukherjee and others, deficiency in service was upheld in view of the erratic medication and the poor records at AMRI hospital. In one of the case, this is Ramanlal Trivedi versus Dr. Satyanarayan in Visakhapatnam, in Gujarat. Gujarat High Court said that hospital and the doctors were held guilty as the case records were not produced before the court to refute the allegation of the lack of the standard care, because they said that case papers have lost it. And in Raghunath Raheja versus Maharashtra Medical Council, Bombay, the hospital and the doctors may be justified in demanding the necessary charges for supplying the copies of the case paper, because patient relative went there stating that they are charging extra for the copies, but the doctors have the right to do it. In this, Dr. Qureshi versus Padwadi in Bhopal, the doctor in the hospital was found negligent as they could not return the case records and destroyed much before the stipulated time. So again, they were held negligent, stating that probably you wanted to hide something, so you have destroyed the case paper. In Ruby Clinic in Pune, Bombay High Court held that patient has the right over his record and hospital should provide a copy of it within a reasonable time. That's what I told you, within 72 hours. So again, the patient had upper edge over the hospital. Thank you very much. If you have any questions, I'll be happy to answer them. Thank you one and all for giving me an opportunity to share my views on medical records and legality in our day-to-day practice.
Thank you, Dr. Shivkumar. We
Yeah.
can take the question and answer sessions after Dr.
Sure.
Kariganuru's talks. And I am happy 100 people have joined directly, and
Yes,
many
sir.
have joined by YouTube, and so also many have joined through Artho TV of Maharashtra. So I request all to speak in English only. And
Sure,
thanks
sure.
to Artho TV that is Dr. Neeraj Bijlani, who is helpful in broadcasting it in Artho TV, so that the doctors of Maharashtra are also benefited. Now I request
Yes, it's very.
Dr.
Yes, sir. Continue, sir.
Dr. Rajalakshmi to introduce our guest speaker, Dr. Madhusudan Karaganur.
Screen share ಕಾಣುತ್ತಾ? Can you see the screen?
Yes, sir. Yes, sir. Yes, sir.
ಕಾಣಿಸುತ್ತೆ ಸರ್. ಗುಡ್ ಈವ್ನಿಂಗ್, ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ. Thank you for the opportunity. The next topic is on professional indemnity. The speaker is Dr. Madhusudan Kariganur, sir. He has been the past president of IMA KSB. He's practicing at Government Medical College, Bellary. He is the cultural and literary secretary during his student days. He was the editor of IMA Focus, during which time he has won the National Award for Best Publication. He has been on the task force member of COVID committee of Government of Karnataka. He has conducted many camps and many motivational classes to the students. He has won Bharani Chetana Award and Medical HR's National Award. He is going to speak on an important topic of professional indemnity. In these days, when we have to practice more of in a defensive way, let's listen to sir on professional indemnity. Over to you, sir. Sir?
Yeah.
Yeah, okay.
Can you hear me?
Over to Dr.
Can
Madhusudan.
all of you hear me?
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes, sir. Carry, sir.
Yeah. Thanks for the. Somebody is speaking. Disturbance. Yeah. Thanks for the introduction. But I'm not working in a medical college. I'm a freelancing surgeon working in one of the very remote places of Karnataka, that is Sirguಪ್ಪ Taluk. ಇಂಗ್ಲಿಷಲ್ಲೇ ಮಾತಾಡಂತ ಹೇಳಿದ್ದಾರೆ, ಬಟ್ ಕನ್ನಡ ನನ್ನ ಮನಸ್ಸಿಗೆ ಹೆಸರಿರ್ತಕ್ಕಂಥ ಭಾಷೆ. ಕೇಳಿಸುತ್ತಲ್ವಾ?
ಕೇಳಿಸುತ್ತೆ ಸರ್, but the
Yes,
problem
sir.
is some of the
ಇರ್ಲಿ ಸರ್, let them. I'll speak about the topic in English. ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಶಾಖೆಯ ಸಾರ್ವಜನಿಕ ಶಿಕ್ಷಣ ಉಪಸಮಿತಿಗೆ ಧನ್ಯವಾದಗಳನ್ನು ಅರ್ಪಿಸ್ತಾ, this is one of the very important topic where when I took over the chairman of KPPS, I had a dream to start a monthly program like this. And definitely I'm very thankful to subcommittee for initiating this educative topic for the members, especially medical legal aspects. And I definitely appreciate Dr. Shivkumar, who has made my work very easy. And definitely this is one of the very needed issue for the medical professionals. As our chairman said, our president said, ignorance of law is not an excuse. We need to know the law. We need to learn and know the laws of the land, which is pertaining to our practice. And one of that is professional indemnity. And you need to know definitely, because it is going to help us and make us our profession easy to practice. So better safe than sorry. I'll be changing my slide. Somehow it's not changing. Yeah, we are living in this world. Self-explanatory. Law is only on the wall. Why do we need a professional indemnity? So in 2016, the National Law University Bengaluru, there was a study where there was a whopping rise in 400% in the cases related to medical negligence filed in the consumer court. And out of that, 10 to 15 cases are really genuine. And the bad part is 85% cases are left for the doctors to defend themselves. Even though they are frivolous cases, we are supposed to defend ourselves. And majority are due to, as Dr. Kumbar spoke, that is the very, very important point aspect, because majority are due to improper consent or inadequate documentation. That is important because doctors' negligence per se is very less percentage of the cases medical negligence is noted, but it is, as he said, the judges read in between the lines. So documentation is very, very important. So what is happening now? Why it is gaining so much of importance? So it is because of declining credibility of medical profession, as you know, definitely, and professional jealousy among our professionals, commercialization of medical profession, and incorrect medical record keeping. And there is a strong consumer movement in our country, and there is a growing patient consciousness for quality care. They are expecting quality care because the financial status of the patients is increasing. They're asking for the quality, and exaggerated claims encouraged by the lawyers. They exaggerate a very minor negligence also in a very exuberant way. And there is a strong likelihood of garnering empathy to the patients from the judicial system. They express their sympathy towards the patients rather than the legal aspect or the correctness of the medical field. And definitely, we need to accept that there is a decline in ethical practice among ourselves. We have to correct our house. And when the case comes, when somebody puts a case on a doctor, definitely most of us get disheartened, and most of us would say that we are not expected to be sued. We are confident that I am a very good surgeon, I am a very good practitioner, I have a very good surgical skills, I have a medical skills, clinical acumen is good. But definitely when it comes, it comes as a shock. Even though subject-wise we are strong, mentally strong, but when it comes to legal aspect, definitely it comes as a shock to the medical professionals. Definitely it will hurt our confidence because we always wonder whether we would have done something differently in that given case. And it is important to accept the fact that no matter however good we are and how hard we try, there will be bad outcomes under our care. Definitely, however skillful we are, definitely bad outcomes are there in the profession. And we should also understand that bad outcomes are definitely not necessarily equal to bad care. We have not done we have done a bad care, that's why it has happened. No, it is a complications of the procedure. And surprisingly, this is very, very astonishing. The risk of being sued for the medical practice has little or less to do with many mistakes a doctor makes. Because analysis of malpractice suits, actually there is a study where analysis of medical malpractice suits actually shows that highly skilled doctors can be sued a lot, while other doctors who make lot of mistakes will never do. They will not be sued. And primary goal of all of us today is to avoidance of the lawsuit and medical malpractice. And most of the doctors call it as a crisis, saying that they want to retire early because of altering, or they want to alter the practice, and they alter their practice towards a negative practice, a defensive practice. And what is the scenario in our country? India is recording 5.2 million injuries each year due to medical errors and adverse events. This is the very neglected part of our, or we are very less aware of these things. We think we are doing very right things without any major mistakes we are practicing, but this is recorded that 5.2 million injuries are happening in our practice. Due to these injuries, approximately 3 million years of healthy life are lost in India each year. And health error is one of the is the 8th leading cause of death in the world, and over 7 million people across the globe suffer from preventable surgical injury every year. This is preventable. It is not the complications, this is the preventable. An average hospital ICU patient experienced almost 2 errors per day, errors by the medical professionals per day. 1 out of 5 of these errors definitely are potentially serious or even fatal. So research has shown that overall competency, because I am very much skilled, I am not getting sued. Research shows that overall competency is not correlated with getting sued. This is what makes us crazy and makes us to practice defensive medicine. And imagine these errors, if it is compared to other system or profession, if these performance levels are applied to an airline or a banking industry, how lethal they are. It will equate to 2 dangerous aircrafts landing per day at an average airport, and 32,000 checks deducted from a wrong bank account per hour. This is equated to the errors what we commit. So much vulnerable we are into this litigations. So definitely uncertainty is the about the consumer thing is uncertainty of the amount of compensation to be paid. It varies from 1 lakh to 1 crore to 10 crores. The amount is quantified based on the mental trauma and stress caused to the patients, which is definitely huge at present. Further, for the longest time in India, patients used to, they never used to link this negligence into a compensable thing. That is making us very crazy now. So this is where we are living. The system is the down, and the people expect us, the system expect us to behave the other way. So better safe than saying sorry when it happens. So for you all, our IMA Karnataka Personal Protection Scheme is there. Definitely it will protect you. And what is it? IMA KPPS is a mutual concept scheme of IMA Karnataka State Branch to financially safeguard the medical practitioners against the legal costs and claims for compensation by the patients in case of a legal row. And IMA KPPS, it gives protection against Consumer Protection Awards, Act Awards, and on professional negligence, fight litigations at district, state, and national consumer forums, commissions. It provides a protection. This is very important. It provides protection up to 1 crore. It provides an indemnity to the IMA members of Karnataka up to 1 crore. Only IMA KPP members will be covered and not the hospital are attached. This is an individual indemnity coverage, not the hospital or group coverage. It covers pathologists and microbiologists, but not the labs they are attached. And the KPPS undertakes to offer its members the services of panel of advocates for their defense and bear the legal expenses. We have retained a team of expert advocates with us now for the last 4 to 5 years. They are with us. They are fighting on behalf of our KPPS members. If the members wishes to have independent lawyers, they have to take prior permission from managing committee of IMA KPPS, and their fee is as per the IMA KPPS rules. It is not at the whims and fancies of the private lawyers. And even our advocates also, their fees is fixed per case, per hearing, and also their annual retainer fee is also fixed. And legal notice. Whenever a member gets a legal notice for alleged negligence in management of his patient, he has to contact the KPPS office with a copy of complaint for which he has received, and then later IMA KPPS will send the documents, all their documents to the advocates, and they have to be in continuous touch with the IMA office and also advocates to prime them regarding their cases. And what is the premium for this 1 crore? This, as I said, it is a mutual concept scheme where this is one of the very novel concept that is developed in first time in India, where Karnataka brought this into practice, where the brainchild, this is the brainchild of Dr. Yogananda Reddy and Dr. Honnegowda, wherein they studied the legal burden of the Kerala state, where nearly 50 to 60 cases were happening per year, and the compensation they are supposed to pay overall was not more than 1 crore to 2 crores. For that, 6,000 to 7,000 doctors used to pay 20 to 30,000 per 1 crore for a year, which was amounting to 200 to 300 crores, wherein these third party service providers, indemnity providers were taking for just giving the compensation of 1 to 2 crores. So they making a profit of 250 to 300 crores per year. So what we thought was, why can't we introduce a mutual concept into the scheme? So based on that, your premium, every year's premium is not fixed. It varies. It varies, depends on the compensation paid to the doctors in the medical negligence case in the previous year. Example, yearly premium will be calculated depending on all the expenses. All the expenses means the compensation amount paid to the doctors, to the court, or to the patient, and the legal expenses of the advocates to fight the cases, and that will be divided among the active members of the IMA KPPS. For example, if we have spent around 20 lakhs this year, so that will be, if active members are 2,000, 20 lakhs divided by 2,000 members, it will become 1,000 rupees plus 500 renewal fee. Your annual premium is fixed, will be calculated to 1,500 rupees for that year. If the compensation of that year is not paid, you are supposed to pay only 500 rupees as a renewal fee. It keeps varying. First year we had, this is a 4-year old new scheme now. Earlier we started this KPPS in 2000 exactly. So this is 24 years. In 2000, exactly 2020, we started this new scheme. This is 4-year old now. So first year we had a premium of 500, second year 800, third year again 500 rupees. This fourth year we had 3,000 rupees because we were supposed to pay the GST of 36 lakhs to the GST commission, which was demanded by the GST commission. That's why 1,700 rupees was the more premium for the last year. Probably next year onwards, the GST burden will be very less. So how do we inform the members regarding this renewal fee? Notices will be sent to all the members from March 1st onwards, because many of the members are demanding, because the employees demand this bond of medical indemnity before April 1st. That we have made a point to make them and reach this notices to them within 31st April, so that they can pay and get the bond from IMA KPPS office. And they have to pay the premium in time. We will send a notice in the within April, then a reminder notice within July 15th, then a third and final in August 15th. Before August 15th, we will send final notice. If they don't pay within December 31st, then the member will be terminated from the scheme, and he will not get any help or compensation from the scheme. And the basic important is continuation of membership is mandatory to avail the benefits of the scheme, because if you have paid the premium this year, if you don't the premium, if you are a defaulter next year, you will not be getting the compensation or help from the scheme if something happens in the next coming year. And we cover only prospective cases. No retrospective cases will be covered, because if you are a member from this day, if the cases happens from this day onwards only, we will be covered, not on the previous. how you should be, you will be contacted. Official issue a demand notice, that as I said. Disbursement of the legal aid. The KPPS undertakes to offer its members the services of the panel of advocates for their defense or bear the legal expenses. So the office in turn will go through the documents submitted by the KPPS member, and after receiving the letter of selection of advocates from the member, the office will write to the member approving the same and write a separate letter to the advocate concerned to help the member. The member will contact the advocate with all the papers and discuss the case. The following case papers should be submitted by the member in case of legal notice: photocopies of the outdoor, indoor case papers, photocopies of the investigations done and treatment given. All these should be according to the performa, as Dr. Kumbar said. The member is requested to be in constant touch with the advocate and also office during the course of the legal proceedings against him. And to tell you, this is an individual benefit scheme. Hospitals will not be covered, and all the doctors have to become the members of. They have to be member of the IMA KPPS, and member cannot hold more than one membership of the scheme at a time. Because if you want to have a indemnity for 2 crores, you cannot you cannot be given a chance to pay the 2 premium and then become a 2 crore. Not that way. The maximum indemnified amount is 1 crore. So if the member is having attachment, the scheme will cover only the member and not the hospital for which he is attached. As I said, even the lab also. Members of the scheme having nursing homes and calling consultants for providing treatment to their patients or admitting patients of other doctors shall see that those doctors who visits and do surgeries or do consultations also should be insured in the scheme. And eligibility, they should be a life member of the IMA and should have a registered Karnataka Medical Council, including his PG or diplomas. Membership becomes effective from the date of realization of the check or DD or electronic transfer of the bank and approval from the MC. And the cause of action must be within the period of the active membership. As I said, continuation of the membership is mandatory. And IMA KPPS, it prepares you for the unseen risks, keeps your practice running, keeps your assets safe, pay your legal costs. Definitely it boosts your confidence to practice a positive medicine. And we have a very systematic way of keeping the records. And we have our very dynamic website wherein all your receipts, payments, everything will be dynamically keep changing and updating. You can just go IMA kppsbengaluru.org. You can see everything, even application, your payment details, the case details, our meeting notices, and our even the minutes of the previous meetings also, annual general meetings, everything, all the details of the office you can just see. So we are living in this world where we have to live with these people, such people. Definitely the judiciary equates all of us to these people. So our offices, and definitely the law abiding people are very less in our country. We need to defend ourselves against these people. We have to defend ourselves. That is the thing. And this is the admission fee for our KPPS. At the time of joining, you need to pay 3,700 rupees to the office. And every year you are supposed to pay 500 rupees. The 3,700 rupees at the time of admission you need to pay. And you can download the application from our website. And in the coming days, we are making it online membership process also we have initiated, wherein you just open the link, enter all your data and submit your Aadhaar card, IMA certificate and your PAN card with necessary payment made through online, PhonePe or Google Pay or through your account payee. Then and there itself you will become the member of IMA KPPS, subjected to the clearance from the managing committee, because we need to check all the documentations, whether he is a member, whether his Aadhaar document is correct, everything we will check in the office, our secretary, treasurer, myself, all of us will cross check, then we will approve your membership. Can save this page. This is a QR code for our IMA KPPS. We have our this thing also, can take a screenshot, bank account also. You can directly transfer your amount, then submit the physical records. Next, by January 31st onwards, we wanted to introduce this online membership process. So office is in Chamarajpete, our IMA headquarters. We have a very beautiful office, well maintained, digitally updated. So join our IMA KPPS, secure a profession. Thank you very much for the opportunity. Any questions rather than me talking? I'm glad to answer the question.
Thank you, Dr. Madhusudan Karigarar. Thank you for your efforts to make a doctor's life easy.
Sound.
Total peace of mind. Those who want to ask questions, please raise your hand so that we can handle the questions. I am sure there are a lot of questions. Even earlier also, many people were asking some questions about professional protection scheme. And please raise hand so that I can allow you to unmute.
Anybody can ask to any of the two speakers, sir. Kumbar sir as well as Madhu sir.
Sir, few questions are there in the chat box. Yeah. We shall answer first them. So
there are a few questions in the chat box. I have already typed and tested it. And for any queries, and Madhusudan can, I think, is a better person in KPSC. I will answer those. And directly you can ask many queries regarding the medical records. Thank you.
Dr. Manjunath, you can speak.
Good evening, sir.
Good evening.
Good evening, sir. So, like, the case bandide, like, division bandu amount, it will be like a certain amount, like 5 lakhs to 10 lakhs. Otherwise, like, it is a whatever the compensation is given, that will be settled down.
Well, I couldn't get your question.
So, like a private insurance, what they will do is, like, per case they will limit to this is the amount they are going to settle on this.
There's a question wherein there is a concept of AOA and AOY. There are some disturbances there.
Disturbance is there, sir.
Yes, sir.
Okay, now it's
AOY and AOA. This is very, very, see, there is a say. I always say, in IMA schemes, we try all our ways to give. However, in the private companies, they try all their ways not to give. We call the member, we call the branch, we call the secretary, and we call the member himself, the KPPS members, what is the grievance, we will guide them. That is one thing. The second thing is no hidden small what do you call a disclaimer, things like in IMA KPPS, wherein there is a disturbance from
Kumbar sir, you are connected to
both.
Mobile is
yeah, that is somebody connects to mobile and laptop it will have. So there is a concept in insurance company where the professional indemnity is calculated in terms of 1:2, 1:3, 1:4. Any 1 year equated, I mean, in the ratio of any one accident, AOY. If it is 1:2, if you are indemnified 1 crore, your first case will be covered for 50 lakhs, your second case will be covered for 50 lakhs. For example, your first case is compensated by the court for 75 lakhs. The insurance company will give only 50 lakhs. The 25 lakhs you are supposed to from your pocket, because they reserve that 50 lakhs for the second case, 1:2. If you are covered, if you have signed with them 1:1, and only one case will be covered For example, if the court awards 15 lakhs for 1 year, for that year, even though you are indemnified for 1 crore or 2 crore, they will give 15 lakhs, they'll forget. In the second case, they will not entertain. However, IMA KPPS, it is up to 1 crore. 1 case, 2 crore, 3 case, definitely we will fight on behalf of you till you reach that maximum level of 1 crore. If the first case is compensated for 15 lakhs, we will give 15 lakhs, you will have 85 lakhs in your reserve.
Yeah, I'll add to this what Madhusudan said rightly. So any one accident in any 1 year, okay, and usually private companies, they keep it very hidden. Nobody goes to that. Just like LIC policies disclaimer, then nobody reads it. I had one doctor 6 months back. He never knew. Okay, it was 1:4. Okay, and he was awarded 50 lakhs, and insurance company came forward with only claiming of 12.5 lakhs. So he has to sell off from his pocket. He started fighting with the insurance company. Insurance company categorically said that your agreement with us is 1:4. Any one accident in any 1 year. So you couldn't do anything for that. So these are the very meticulous things when if at all you are going for the private insurance companies or indemnity, you have to be very, very careful. If we are expecting more than 3 to 4 cases per year, I think it's the high time we must stop practicing.
Rather than stop practicing, sir, let them become KPPS member.
Yeah.
We will support them.
The best thing is KPPS. It's the need of the hour now. I urge all youngsters, okay, and they get indemnified from the KPPS. It can practice. You can practice very peacefully, right?
Yeah, Pallavi Prabhu, somebody asked, how do you get enrollment in KPPS? Definitely, you can visit our website, madam. Our application is there. You can download, fill it. Only 3 documents we need. Your IMA certificate. If at all, if it is not there, just enroll. Write your branch name, your IMA number, Aadhaar card, PAN card. Just send it. We'll take care of it. Harsha GV, please make KPPS premium once in 3 years, sir, by calculating projected premium.
Actually, compared to
Sir,
that is the question they have asked, but very difficult because it is a dynamic process of calculating. We cannot speculate how much will be the expenditure next year.
Disturbance is there.
Yeah. Sir, heady.
Yes, sir.
Chinivala, sir.
Chinivala, sir, network weak agide.
Yeah. In 2024, for how many cases IMA case were settled by paying compensation? We have paid only 1 case for the radiologist. 15 lakhs we have paid. That is at the district forum awarded case. We have challenged that in the state forum. Definitely, we are confident we are going to win it. At present, we have 39 to 40 cases with us. 5 cases have been disposed. Remaining 32 cases, we are at 8 now.
Yes, sir.
Yeah, Kumar sir, one question. Yeah, Dr. Kumar.
Yeah, please.
Kumar sir, one question. Regarding telemedicine, recently there was one case. A pregnant woman has been prescribed one wrong medicine. It was a prescription wrong diagnosis, and they filed a case. Recently, happened in probably in Delhi, especially anti-thyroid drugs, Eltroxin. So instead of Eltroxin, they are given something like a Etroxoxide, something like that. So they filed a case. So what is this telemedicine prescription wrong diagnosis or something like that?
No, sir. Strictly speaking, telemedicine is not advocated in India. It's only in the COVID period they wanted to come tide over the crisis. Okay, rules and regulations have not been framed. So automatically, we would say that telemedicine is not advocated with the rules and regulations given by the NMC. So naturally, doctor is accountable for that. Any of the misdeeds, what happened, whatever is telephonically ordered.
Sir, the thing is that recently what happened, the doctor has written correctly, but the medical shop people, they prescribed it in a different way. Instead of eltroxin, they are given atrocoxin. So that is a wrong medicine they are given, but which doctor don't know. So this patient attended, they filed case against the doctor. So that's what happened recently.
No, the two things, sir. Usually, whenever the doctor prescribes a medicine to any person, usually patient has to buy it back and show it to the doctor. That is the one thing, which is practically not possible. In this case, automatically the pharmacy is held accountable for this. They can file a case on the pharmacy and get the remedy for that.
So instead of that, they are filed against the doctor. And also, they told
you can
doctor
defend it.
can
You can
file a
defend it.
case.
No doubt about it. You can defend it, but pharmacy is accountable for this.
one more question is that in Chennai, but recently what happened regarding third opinion? So somebody has told something different. So this son of the patient who died, he hit the doctor. So that's what happened in the Chennai. So what is the law says about the third opinion?
See, there are two things. The opinion per se is the discretion of the patient or the relative, where exactly he can take a third opinion, he can take a fourth opinion. But if you are not sure of your diagnosis, definitely the discretion of the doctor to take a second opinion. So nobody asks you to take a third opinion or fourth opinion. If you are happy with your own opinion, you don't have to go for a second opinion. Patient can go for a second opinion. If you are happy with that, yes, you don't have to. And if you are not sure of it, you can take a second opinion, a third opinion to come to a conclusion in the wellness of the patient. But he has a liberty to take third opinion, fourth opinion, fifth opinion. You cannot stop it, sir. You cannot stop it. But if you don't feel like taking second opinion, you can justify it. Okay, nobody asks you to take for the second opinion. It's we're a will and we're expertise, we're desire to take it or not. This is very well documented even in the court of law.
Sir, one more question is that in the conferences, especially the workshop, this government has banned that you should not operate on any person as a live in the workshop. So what law says? So that's
No, you should not operate
on especially in the workshop, live workshop.
Workshop?
Yes, sir. Yes, sir. Live workshop. The recently government has said that you should not operate on any patient. Even with the also don't operate on in the workshop, and it should be demonstrated.
See, recently there are 2-3 cases all over India they have come across, and the one is a confidentiality, privacy patient has to be maintained. The third one is without the patient's consent, you cannot. Okay. The third one is, say, we call it as a flying squads or flying surgeons. Okay, and they come and operate and they go off. So who is liable? He may be in Bombay, he may be beyond borders in India. So in this scenario, 2-3 cases happened that they should not be allowed now. It can be permitted only with the consent of the patient. That can be done, sir. There is recently one Gujarat High Court came with a clear guideline stating that live cannot be done unless the patient gives a valid consent. It can be done.
Along with that, they need to inform the state medical council.
Yeah.
Before operating, before coming and participating in the live workshops, they need to inform the.
They need to inform the respective state council. And they have to fulfill the requirement of the state council. Yes.
Dr. Shivkumar, sir, I have one question. These days, digitalization, because of the digitalization, most of the hospitals are becoming paperless. What is the role in court of law? This digitalization, is it okay, acceptable?
Yes, sir. Digitalization as evidence in the court of law is very well accepted for the last 6 years. It is accepted, sir.
Okay.
But the only thing is, we must convince that there is no tampering. It's a very confident it is maintained. And it all depends how you prove the sensitivity of that, authenticity of that system, what you are using it. But all courts are accepting as evidence value.
So I have one question for Dr. Madhusudan, sir.
Yeah.
Professional indemnity. Some patients, most of the doctors are having both KPPS as well as private indemnity. Do you recommend to have both, sir, or one is sufficient? If I have KPPS, I need not go for any other private professional indemnity. Or what is your opinion, sir?
Sir, there are different aspects to indemnity because we don't cover the criminal aspects of the doctors. The second thing is this is not a hospital-based indemnity. So if the private indemnity people or insurance people give these things, it is left to the member. But we are at present covering only the consumer aspect of the law. The compensation aspect, that will be the burden. Out of court settlement also we are not entertaining. This is purely the consumer commission oriented indemnity. That is the, I don't call it as a restriction, but our motto is to help our member rather than promoting the out of court settlement or criminal aspects of it. We don't cover it. And as far as the question is concerned, I think KPPS covers these legal aspects. That is the most dreaded part of the legal aspect is paying the compensation. That is taken care by the KPPS. And many people, many of our members at present, we have around 3,900 members at present with KPPS. Few of them have a double indemnity coverage, something in a private and also KPPS. So what we do is, because there is also an element of the understanding between the advocate, patients, and the system, wherein they should not take the advantage of having an insurance. Intentionally, the doctor should not lose the case and get the compensation and get themselves the what do you call their part of things. These things are happening in insurance coverages, vehicle insurance coverages. You know it.
So you mean to say, if I have KPPS, I need not think about any private.
Yeah, no need, because anyhow, to fight against the criminal activities, we need to have a different setup. There are all attractions, as I said earlier, and Kumar also stressed upon. We want to give, we want to support. Many of the doctors, when I went into this indemnity details, when I contacted most of the doctors who are they are availing the services of the private indemnity schemes or services, very, very difficult to approach them. Advocates and medical, the best part of IMA KPPS is the medical knowledge people are there to support you. We think about the case, we discuss about the case, we support our advocates where and how we can fight with the case. But exclusive medical consumer advocates are very hard to find nowadays, because if any of the advocate of your place has to take up your case, you need to feed them over the medical knowledge. Very, very difficult. That is a very difficult part. People, because even the judge, advocates, they always equate the complications of a medical procedure to a negligence. There is a very thin line between the negligence and complications. So that we can definitely, what do you call, tune our advocates, which is not possible in the private insurance companies. You have to put in a lot of efforts individually, where our team puts the efforts here.
Thank you, sir.
Sir, mute. Unmute.
Dr. Pradeep Kumar is trying since a long time. Dr. Pradeep?
Yeah, Dr. Pradeep Kumar, sir. Dr. Pradeep.
President, sir,
thank
wants
you so
to say
much.
something.
Yes.
Namaste, Doctor. Namaste,
Hi,
Doctor.
Pradeep.
It was a fantastic session. Thank you so much for this. The help that I required was, I'm being a hospital owner. Is there any similar scheme that is available by the IMA KPSS to cover up for the hospital? Is there any scheme that's available?
Sir, very simple strategy. If a hospital have 20 doctors, let them become the member of the IMA per se, IMA Karnataka State branch, or local branch. Then let them become the member of IMA KPPS. That also works out very cheaper, because if you go for a private indemnity, each doctor has to pay 20,000 rupees for 1 crore. I am telling the least possible amount. At present, the market for 1 crore is 25 to 30 lakhs. I mean 30,000 per year, wherein if you are indemnified for 1 crore, they will deduct 30% of that 1 crore as the legal expenses. Your compensation, if it is 1 crore also, they will give only 70,000. They'll deduct your 30 lakhs as the legal expenditure. Even that also a burden. Imagine 20 doctors working in a hospital paying 20,000. How much it works out? It works out huge amount. So let them become individual KPPS member.
Right.
20 doctors into 2,000 rupees. How much? 40,000. You will be indemnified for 20 doctors.
Okay. Okay. Right.
Yeah.
Thank you, sir.
Dr. Desai, Junior Doctor Association, Jitin Desai, wants to speak. Yes, sir. Chiniwala, sir. President,
Somebody
sir.
asked question. Can we become IMA KPPS member at any time of the year, or does it start from March 31st? They can become any member at any time. What you have done is we have divided their membership in quarterly basis. I mean, 1/4, 1/4, 1/4. Because if you become a member this January, for example, your indemnity starts from that day itself. However, you need to pay the premium for first 3 months. January to your premium will be calculated for first year. It is a cut premium, we call it as. You will be getting 1/4 of the premium supposed to be paid. For example, if the premium for the scheme is 1,000, you have to pay only 250 for first 3 months. Then next year onwards, every year from March onwards, academic year, you will be given the notice of premium.
Yes, sir.
Even if we pay now,
yeah, even
if we pay now,
because you are paying 3,700 rupees as a membership fee. Okay.
3,700.
Yeah, you will be covered from this year to from January to next year January. Okay. You got my point?
Yes, sir.
Yeah. So this is not yearly premium that we calculate, because for the office purpose we have made it academic year, March 31st to April 1st.
Yes, sir.
So one more.
Yes, sir. Please.
Day before yesterday, I had sent one on the WhatsApp ಗೆ cover you ಅಂತ ಹೇಳಿ ಒಂದು India's largest broker ಅಂತ ಹೇಳಿ ಕಳಿಸ್ಬಿಟ್ಟಿದ್ದಾನೆ.
I followed. I am following it many years.
Yeah.
Cover you is since many years.
cover you ಅಂತ ಹೇಳಿ indemnity as well as health insurance ಬಗ್ಗೆ regularly sending me a mail as well as WhatsApp, and this one even tried to call me.
Yes,
and also stating that it has been endorsed by many of the specialties, right?
Yeah. Many of the specialties have endorsed already. So he's contacting me daily. Still, I have not given him any this one, because we have got our own schemes, indemnity as well as health insurance. So I have not talked to him.
Sir, I request the president to sue him.
Yeah, yes.
because
he
has used IMA Karnataka State Branch in the first page.
As what, sir? Used?
He has used IMA Karnataka State Branch on the heading ಹಾಕ್ಬಿಟ್ಟು ಅದರ ಕೆಳಗಡೆ ಎಲ್ಲ ಇದನ್ನ ಹಾಕೊಂಡು ಹೋಗಿದ್ದಾನೆ.
ಹೌದು ಸರ್, ನಮಗೂ ಕಳಿಸಿ.
Many specialties, subspecialties, they have put a logo and other things.
If they have MOU with them, let them use their logo. But how can he use us IMA Karnataka State Branch name without taking consent from the Karnataka State Branch?
And you can send a notice also.
It is a misleading ad by him.
So we should send a notice, sir, then?
Yes.
Yeah, definitely.
Yes, sir.
Because, sir, Cover You gets the data from all specialty associations and then contacts each and every member of that association. Even orthopedically, they keep contacting every week or so, almost.
Yeah.
They get the data from all the associations and contact them.
ಹೌದು ಸರ್, ನಮಗೂ ಕೂಡ ಮೇಲ್. Everybody has got. ಹೌದು ಸರ್, ಹೌದು.
He has covered one of the neurologists from Bellary. One patient, one case is there in the state consumer court. He is fed up with them because no contact person for them.
advocate as well as
advocate, and also the office.
ಸರ್ ನಮ್ಮ ಮೆಂಬರ್ಸ್ ತುಂಬಾನೇ ಫೂಲ್ ಆಗ್ತಾರೆ ಸರ್. ಎಲ್ಲರೂ ಹೋಗಿ ಹೋಗಿ ಅವ್ರಿಗೆ ಎನ್ರೋಲ್ ಆಗಿ ದೇ ಗೆಟಿಂಗ್ ಫೂಲ್ಡ್ ಟೋಟಲಿ.
ಅಲ್ಲ, later on they will repent.
Suraju,
Yes, sir.
Can you send one letter to him?
Yes, sir. Yes, sir. You can draft a letter and definitely.
File attach ಮಾಡಿ ಕಳಿಸ್ತಾರೆ ಅವ್ರಿಗೆ. Tell him first in a right ways to sober way to tell him not to use the IMA KSB.
Yes,
right, sir.
Yes, sir. We should do it, sir.
Yeah.
I think immediately we'll do.
We just ask him to withdraw whatever he has using it, and without our knowledge, we request you to kindly withdraw it. Okay.
Withdraw and not to use it henceforth.
Yeah, just a formal letter. That's it.
Yes, sir. That will be advisable. Better, sir.
Yeah.
Good suggestion, sir. Good suggestion.
Anything else? I think if there are no more questions.
Yes, sir. Chinimala sir, anything you want to say, sir, about the program?
Regarding this one,
Anuradha
actually, Rajan, a good forum for Dr. Shivakumar Kumar Avaru has told about how to keep the records and how many years and so on, and regarding the negligence and everything also. So regarding how to come out to this one, so that was covered by our KPPS chairman, Dr. Muthudan Karino, regarding the professional protection scheme. He has enlightened very nicely. So those who have not yet become the member of this one, KPPS, let them become individually. It is not covering the whole hospital. So I request Dr. Rajendra Prasad and this one, Suresh Kagalkar, thanks to them for having such a public health forum. So in future also, they can have such forums once in a month or 2 months, because every Tuesday is not going to be this one. We have allotted slots to various other subcommittees, Tuesday and Fridays. So,
sir, one minute, sir. Veerabhadraya, why not allowing me to talk admin? Veerabhadraya ಅವರು ಮಾತಾಡ್ಸಿ ಸರ್.
Veerabhadraya ಮಾತಾಡಿ ಸರ್.
ಬಂದಿದ್ದಾರೆ
Veerabhadraya ಸರ್.
Veerabhadraya. ಹಲೋ
ಜಾನ್
ಮಾತಾಡಿ.
ಜಾನ್ ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ ಅವ್ರನ್ನ.
Yes, sir. Sir, co-host ಇದ್ದಾರೆ ಸರ್.
ಹೋಸ್ಟ್
ಇದಾರ. ಓಕೆ.
Sir, time
ಮಾತಾಡಿ.
ಲಾಗಿನ್ ಆಗೋಕೆ. We'll have to give time.
ಇಲ್ಲ ಆಗಿದೆ, ಲಾಗಿನ್ ಆಗಿದ್ದಾರೆ.
ಆಗಿದ್ದಾರೆ.
ಸ್ವಲ್ಪ ಒಂಚೂರು ಮಾತಾಡೋದು.
ಸುನಂದನ್ ಅಂತ ಅವರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, ಕೈ ಎತ್ತಿದ್ದಾರೆ.
ಕೇಳಿ.
ರೇಷ್ಮಾ ಸುನಂದ್.
Sir, I have a question here. It is like the recording, no? These days, they will secretly record the conversation over the phone or live also. So that is now not considered as an evidence by court without permission of the opponent, the party they are doing it, no? Recording of phone calls or recording of, live some conversation without the knowledge of the doctor. It's not considered as an evidence anymore, no? They have to take a permission before recording. That is what I wanted to confirm.
Dr. Kumbar, kindly clarify regarding this. There are 2 types of recording the patients do. One, they inform the doctor and then record. Another time, without informing the doctor, they record the conversation that goes on. Kindly clarify on that point.
There are 2 things, madam. They have to take the permission, no doubt about it.
Yes.
But most of the times what happens is, if at all you are sharing your knowledge, if somebody is recording it, nobody comes in the way. If the president is very strict, okay, and he needs some permission, okay, that has to be accorded. Otherwise, again, probably it's a breach of mutual trust, or else again it goes into the confidentiality matters. So
recently I heard it is not considered as an evidence.
Better to get a permission from him. Otherwise, without his knowledge, better not to record.
Yeah, but recently I heard that it's not considered as an evidence by the court if they produce such recordings. That is not there, or it's there. This is what recently I heard.
In the court of law, how it is true, sir? Kumar sir.
Yes, sir.
Is it holds true
The
in the
patient records. If the patient records the conversation with informing the doctor, without informing the doctor? Without
No,
informing,
no. See, there are two things. There are two things. When he's sitting in front of you and he's recording without your knowledge, and he produces somewhere else, okay, without your knowledge, you can show him. You can show him, no doubt about it. But if at all he has, with your knowledge, he has given, it is valid. But the only thing is, if he is misusing it, he is exploiting you, okay, definitely you can have a contempt of court on him, and it's under BNS, okay, new act, is a punishable, he can be dragged to the court.
Okay, sir. Thank you. Even the video recordings during the scan, I'm a city medicine consultant. So even video recordings, we don't allow any relatives now inside, but sometimes they secretly do this video recording of the ongoing scan.
Record,
that is
even
100%
in
illegal.
the MCI, recording without the knowledge of the doctor, it is the criminal liability on the part of the patient or relative who is recording it without their knowledge.
So we are no more allowing any relatives as per the PCP and AT norms, but this was also happening before.
Yeah, but you just text me whatever it is, I'll be able to text you tomorrow, going into the details of it. Okay?
Madam, sir, Shivkumar Kumbar, sir.
sir, anybody else want to speak? I just want to speak just 2-3.
Please.
Kumbar, sir.
Hello, sir.
Yes, sir.
Question to Dr. Kumbar.
Yeah.
Sir, if health insurance people ask for the IPD papers, are we supposed to give?
No, sir. IPD papers, definitely he has a right to ask it, and you are required to give it. Okay, within a stipulated time.
Yeah,
and you can buy some time to give him the IPD papers. In the meantime, you can charge your fees also for that.
Okay.
So it is the right of the patient to get all the indoor case paper, a copy of it, and get a written copy from him that he is required. He is asking for that.
Not the patient, sir. He's asking about health insurance people. Can they directly take it?
No, they cannot, sir. They cannot take without the knowledge of the patient.
Patient.
You cannot give without the knowledge of the patients also. If the patient gives the consent to you, so and so insurance companies, I am relinquished my papers is produced, they can give it. Otherwise, you cannot directly give to the insurance company.
Okay, sir.
Okay. If they ask also, we have to take a consent from the patient.
100%, sir. 100%.
Through the patient.
Right, sir. Through the
We have
patient.
to
Got
take a
it.
written consent for the patient. Okay,
Right, sir.
and so because they can misuse it. Okay, without the knowledge of the patient, which you are not supposed to do it.
Correct. Okay, sir. Okay, sir.
So Dr. Desai, Dr. Jatin Desai, Junior Doctor Association, he wants to speak few regarding. Yes. Dr. Jatin Desai?
Yes, sir.
Please go ahead.
Am I audible, sir?
Yeah,
please.
Yes.
Yeah, continue.
Good evening, each and everyone.
I think you are muted.
Yeah, pleasure to be here. Thank you for giving me this opportunity. Myself, Jatin Desai.
Yeah, continue.
Hello, sir. Am I audible now, sir?
Yeah, you are audible. Introduce yourself.
Sir, am I audible,
What you
sir?
do.
Yes, sir. Yes, sir.
Yes.
Yeah, continue.
Yes, myself, Jatin. Yes, myself, Jatin Desai, sir. I am a Junior Doctors Network president from Vijaypura. I am an intern in Al-Amin Medical College, Vijaypura, sir. First of all, I would give my sincere thanks to each and everyone on the panel, organizers, IMA KSP for giving me this opportunity. A very fruitful session, especially from a very recent graduate, I would say that such knowledge about the real life practice is almost very important for each and every newly graduate MBBS doctor who comes in this field. So I would really like to thank Dr. Shivkumar sir and Dr. Madhusudan sir for sharing their point of views regarding medical negligence as well as KPPS. One request from my side would be that it would be really fruitful for if we arrange such another session for the newly graduates or who are freshly interns for one particular reason, that is before starting of their clinical practice or before entering into their post graduation. If we have the knowledge of this firsthand, that will be better for us to tackle any future problems. It shouldn't be like we learn after we experience. It's better to learn before we experience such as certain things. And if we could have such a session for the interns and post MBBS, it would be really
Sure, sir.
great.
Sure.
Yes, sure. Madhu sir will clarify.
Yes.
Yeah, it will be done. It will be done, sir. Okay. Yeah.
Yeah, it will be done. All the medical college will be covered. So whenever office bearer will come to the district level or college level, definitely they are going to tell about the
Dr.
scheme.
Suresh, take their contact number and be in touch with them.
Yes, sir.
Definitely allowed to share my knowledge with them. Okay, maybe anywhere. Okay.
Kumbar, sir. Kumbar.
Thank you, sir. Thank you very much.
Kumbar.
Yes, sir.
There is a amendment in 2009 Karnataka Act against the violence against medical professionals.
Yeah.
Recently, they have clearly included, the one lady has asked the question, unauthorized recording. Okay. So they have mentioned it where I just read the clause a small a, intentional insult means use of words, figures or gestures with an intention to insult, humiliate, disgrace, annoy or abuse a Medicare service personnel, either directly addressed to him or through social media or through unauthorized audio or video recording.
Yeah.
They are punishable. And photographing in connection with the professional duty. See, we are included. They are punishable act.
Yeah. In 2009, yeah.
Yeah, 2009, it is amended recently. This
Correct,
amendment is not in Karnataka.
Yes. Yeah.
It is the efforts of the IM Karnataka State Bench. Definitely, I appreciate the leaders.
So I have one question.
Anything else is there? I think.
Dr. Shivkumar sir and Dr. Madhusudan Karikul, one question, sir.
Yes, sir.
It was like IPC sections were there. Now it has turned into BNS. Okay, sir. Is it applicable still? IPC sections is applicable, sir? Or the
which one, sir? Which one?
IPC sections and now latest is BNS.
Yeah.
So both are same, or we need to mention BNS?
Dr. Suraj, IPC, okay, which was in the British colonial era, okay, and it is changed. It's changed, no doubt about it. It is something like a boon or a bane for the medical fraternity, okay, and it is a different topic altogether, okay. The pros and cons are boon or bane of the BNS, especially one act, okay, and I would say that it has given a relief to some doctors, okay, those who are registered under the respective medical council or NMC. So whoever causes the death of any person because of the negligence, okay, they are accountable for the imprisonment for 5 years with a fine. But if the same patient dies, not amount to culpable homicide, okay, he is penalized with a fine and imprisonment for 2 years. So earlier what was there earlier 3 or 4 years? Either imprisonment or fine or both. But in this act, imprisonment is compulsory, fine is also compulsory. Yeah. So definitely, I think probably I would love to have one separate talk on this, maybe 20 minutes or 25 minutes. Okay, probably I think Madhu, in national conference, I'll be speaking on this. Okay, BNS 2024, a boon or a bane to the medical profession.
That is a transition period where I feel both will be applicable as long as we get into this mode, probably on a
earlier any death was compared with the even rash and negligent driver, a truck driver. Now they have put a clause, particularly A or 1, that those who are registered under the medical council or NMC, they should be given only 2 years of imprisonment plus fine is made a mandatory. This is not a welcome move, but we have got to live with that because land of the law.
Actually, why the reason why I asked this question is that we are advising all the IMA members and hospitals to display the boards outside the hospital with IPC sections. So should we mention IPC existing sections, or we should change to BNS? That is my question.
Sir, BNS from July 1st is applicable. Few sections, see, only 15 to 25% of the total IPC has changed. Okay, what is restricted to the medical fraternity? That's what I told you. But the rest of the things have remained the same. Rest of the things, they remain the same.
So we can recommend that old existing IPC sections.
Yes.
Same thing, we can recommend all the IMA members to
Yes,
display in the
yes.
clinics. Okay,
Sure.
Thank you, sir.
Hello,
Suresh, you're
Suraj.
muted.
Madhu.
sir.
Hello.
Dr.
ಅದೇ
S.K. anything else?
ಪ್ರತಿಯೊಂದು ಹಾಸ್ಪಿಟಲ್ ಮುಂದಗಡೆ ಏನಂತಲ್ಲ ಇದೇ ಸೆಕ್ಷನ್ಸ್ ಬಗ್ಗೆ ಏನಂತಲ್ಲ ಡಿಸ್ಪ್ಲೇ ಮಾಡೋಕೆ ನಾವು ಪ್ರತಿಯೊಂದು ಈಗ ಬ್ರಾಂಚ್ ವಿಸಿಟ್ಸ್ ಹೋದಾಗೆಲ್ಲ ಹೇಳ್ತಾ ಇದೀವಿ. ಅದನ್ನ ಏನಂತಲ್ಲ ನಮ್ಮ ಕರ್ನಾಟಕ ಸರ್ಕಾರದ್ದು ಆಮೇಲೆ ಏನಂತಲ್ಲ ನಮ್ಮ IMA ಒಂದು ಎಂಬ್ಲಾಮ್ಸ್ ಇಟ್ಕೊಂಡು ಏನಂತಲ್ಲ ಯಾರ್ಯಾರು ಯಾವ ರೀತಿ ಏನಾದರೂ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಆವರಣದೊಳಗಾಗಲಿ ಆಸ್ಪತ್ರೆಗಾಗಲಿ ಮಾಡಿದ್ನಪ್ಪ ಅಂದ್ರೆ ಯಾವ್ಯಾವ ಕಾಯ್ದೆಗಳು ಇದಾಗ್ತಾವ ಅಂತೇಳಿ ಡಿಸ್ಪ್ಲೇ ಇದೆ. ಅದು ಜಾನಿಗೆ ಹೇಳಿನಿ, ಈ ವಿಲ್ ಡಿಸ್ಪ್ಲೇ ಇಟ್ ಜಸ್ಟ್ ಗೋ ಥ್ರೂ ದಟ್ ಒನ್. Suraj, ನಿಮ್ಮ ಹತ್ರ ಇದೆಯಲ್ಲ?
Sir, we will take this call in our working committee.
I think we will
take a decision. We will come with one module, then we will circulate. ಈಗ ಸುಮ್ಮನೆ ನಾವೆಲ್ಲರನ್ನು ಕನ್ಫ್ಯೂಸ್ ಮಾಡೋದು ಬೇಡ ಇವಾಗ. ಯಾಕಂದ್ರೆ BNS ನಾವು ಅದನ್ನ ಕಂಪೇರ್ ಮಾಡಿ ಹಾಕ್ಬೇಕಾಗತ್ತೆ. It takes some time for the clarity to come.
Okay.
ಹಾಗತ್ತಪ್ಪ ಅಂತಂದ್ರೆ ವರ್ಕಿಂಗ್ ಕಮಿಟಿ ಅಂದ್ರೆ
sometimes. Yes.
Yeah. So legal cell committee ಇದೆ. Let them take a call. Let them come out with a brochure or what display this thing. Some corrections can be made, and then we can leave one standard display board to everyone.
Yeah.
Yes.
Okay. Dr. S.M. Prasad, please, anything? Prasad, sir. Dr. S.M. Prasad, sir.
ಏನಿಲ್ಲ.
KPPS secretary.
It is a very good talk by Dr. Madhusudan sir on our president of the IMA KPPS scheme, and also by Dr. Shivakumar Kumbar. We have highlighted about so much practical difficulties when we are managing patients in both in OPD in the hospitals. So I have got one question to Dr. Shivakumar Kumbar. That is, does this referral things that when we refer from an OPD, sick patients come to our OPD, because most of us are general practitioners, or we may be doing some our own setups, or it may not be in a hospital like a teaching institution or emergency room, but they will come to a doctor or who is practicing in a small clinic when they are very sick. So do they need to keep any record when they are referring to some other hospital? Where is the onus when a private practitioner has to refer a sick case to a hospital?
Yeah. S.M. Prasad, ideally, the referring letter has to be make sure that patient's date, time, the reason for transferring the patient, and also make sure that, okay, right, the way you discharge refer, they will be going over there. Okay. If they go after 2 hours or 3 hours, if something happens, and the very much reason they come back to you or complain to the police or whatever it is, doctor referred it quite late, but actually had referred him a couple of hours back. It is a mistake who took present. So in this case, if you have a duplicate copy of at what time you referred it, it will show you in the court of law. Otherwise, the court presumes that you have referred the patient, terminally ill patient, a critical patient, after wasting so much of time. So best thing is you have a copy of it, a duplicate copy of it attached to the case paper, the time at what time you refer the patient. It will show I have 2 cases when in North Karnataka with me, and we could overcome with that.
Because in many places, what happens when some practitioner is referred to a ICU or this one, so even doctor there, our own friends, they may say, because you came very late to my emergency room, that is why I couldn't save your life or something, or I couldn't treat you properly, like that. Usually they will. That is the thing.
Those things we need to avoid this.
So even there, I think we need to maintain the referral letter.
Yes, definitely we need to maintain, sir. Definitely we need to maintain.
Especially when they are very sick.
Yes.
Sir, very sick, medical legal cases, any trauma, any unexplained poisonings, any unexplained bite, unknown bite, always keep the record.
Yeah.
Yes.
And if you feel, definitely our sixth will say that this patient is a litigant patient. Definitely we have the document.
Yes,
and what happens if the patient Prasad, if the patient goes after the 2-3 hours, rather than going right at the time when you referred him, the tertiary care center, you received him. By the time he must have died on the way, either in the ambulance and the car, whatever it is, the receiving end, they label him as a broad dead patient. Even if the patient is died of the cardiac ailment or asthmatic or whatever it is, the receiving end, the label this as a broad dead patient. Probably again it becomes a medical legal issue or MLC case.
Yes, sir. Yes, sir. Correct, sir.
So the referring doctor also will become a party then.
Yes, 100%. Provided you have a case paper at what time you refer it is important.
Sir, one more question, sir. Kumbar, sir.
Yeah, please.
Yeah, this last year, 2 years back, the Ahmedabad gynecologist committed suicide because the local authority person, he came and he told that this whatever you have prescribed, whatever you have done the practice, we will publish in the newspaper. So she has committed suicide after afraid of all these things happened outside the hospital. Many dilemma happened. So what you should have taken the care? How to?
No. Dr. Suresh, I
Yes, sir.
still remember that case was booked under 304, not 304A. 304A is a non-bailable, publishable, non-compoundable, and the punishment is throughout life, imprisonment throughout life. So in that case, probably she must have gone through the IPC section. She could have gone through 304A. She came to know that probably it's not possible for me to come out of this section or this thing. There was a political rivalry for that case. It is proved beyond that.
So
in that way, she committed suicide.
Yeah. The thing is that what she should have taken to prevent the publication in the media.
No. It is the police people who wrongly interpreted it. Instead of 304A, they booked it on 304.
The media coverage was so bad, it was wrongly impressed that she has done everything. So that's what happened, and she was.
Only for that she has murdered a patient. But for this, we must be happy that under the BNS, okay, we have something safety in this.
Yeah.
Okay. Yeah.
See, whatever said and done, the medical legal case, as I said, definitely it comes as a shock to all of us.
100%.
We need to know the law.
Yeah.
See, she should not have committed suicide.
No. That's what ignorance of law is not an excuse nowadays.
Yeah. She should not have committed suicide because this is where the association and leadership counts. She should have contacted the IMA leaders there.
Probably she would have contacted the seniors or IMA president, national president. Probably the life of the lady would have been saved. It's a gynecologist.
Why should we be afraid of the media? See, we have to be mentally strong enough to tackle these people. We need to, because now should not afraid.
Yes.
Yeah.
We have to fight.
Yes,
That mentality.
No. We all, for all practical purpose, we say that the media is the fourth pillar of the democracy. But this yellow journalism has creeped into the medical fraternity to suggest that they harass openly. I'm capable of telling it. They harass to extend that they extract the money also for the good of their yellow journalism. That's it, I would say.
Yes, sir.
Sir, whatever it is, let us be strong. The associations are there to help the members.
Yeah.
Yes.
That police officer is suspended, and IMA is trying hard to give him punishment, and the trial is going on.
That is okay, but we lost a precious colleague. Medical fraternity.
Yes, sir.
Yeah,
colleague, mother.
That's part of it.
Yes,
sir. In some circumstances, we are practicing, in some situations. Is there any
I think attendance committee, Suraj,
to prevent arrests? Sometimes the police will. Hello, can you hear me, sir?
Yes, sir.
Yeah.
Yes.
Is there any immunity to the doctors to prevent arrest? Is there any existing laws which is available to safeguard ourselves?
Dr. Suraj, definitely. Still, Jaco Mehta case is existing. Kusum Sharma Batra Hospital case is existing, and BNS. Okay, anything done in the good of the patient with or without the consent. Okay, number 26 of the BNS. Okay, definitely it outreaches all the criminal liabilities of the doctors, 2-3 clauses That's what I was even present and I myself will have one session on BNS. That's it.
Yes, sir. Yes, sir.
Okay,
Yeah.
we'll call it a day.
Yeah.
Sir, ನಾನು ಒಂಚೂರು ಮಾತಾಡ್ತೀನಿ.
Yeah, madam.
Hey,
Please,
Anuradha.
please.
As we all know, only 1/10 of our allopathy MBBS doctors after graduation or post-graduation become IMA members. Lots and lots of our colleagues are keen to become IMA members. They don't know how to become IMA members, and they are keen to know about the schemes. All of us, though, quite a lot of our office bearers themselves are not aware about the details of, they're not able to explain the details of the scheme. So I sincerely request our president, sir, our secretary, to send a letter to the to all the branches to make sure that each and every office bearer becomes a part of this scheme. Unless and until I am part of the scheme, I cannot explain in detail properly. So many of them are falling short of social security scheme. 2 days back, one of my friend from Vani Villas, she said, I want the insurance, she wants the professional indemnity. And to explain, none of us, at least I learned, but most of us as office bearers, we are not aware of it. So as part of KPPS, I think Dr. Prasad is there. So make sure that we speak more and more about IMA schemes every occasion that we get in every CME that we get. And once they become, once they get their KMC number, they are eligible to practice, and that is when they should make sure that they have become KPPS members. That is my suggestion. That's all.
In the meantime, Dr. Anuradha, I think last time we had some debate on this. How exactly we should make the IMA members, okay, to avail these benefits of IMA schemes. So any IMA, any session, any talk, monthly session, 5 minutes should be kept for that. For that, I urge Madhusudan, I think probably you must have already prepared it. Last time we discussed that. So that we can send a 5 minutes, a glimpse of our schemes so that they can be presented over there. Otherwise, it can be talked by the President Secretary of the respective IMAs to be aware of those things. I think.
Sir, unfortunately, 150 members of the IMA Bangalore branch are defaulters in KPPS. They have not paid the premium.
Look at that.
Yes.
See, look at the.
Thanks, Dr. Anuradha, madam. Good suggestion.
Yeah, good
So,
suggestion.
within this span of 1.5 months, I have visited nearly 35 branches.
30.
Yes, sir. Yes, sir. Very commitment, sir.
Yes, sir. Yes, sir. Great.
Great in this age.
All the branches, I have myself, Dr. Surraju, Malavegowda, Marigaudru, ಮತ್ತೆ KG Bhat, ಎಲ್ಲರೂ not only IMA membership, IMA ಸ್ಕೀಮ್ ಬಗ್ಗೆ ಇದರ ರೂವಾರಿಗಳು ಯಾರ್ಯಾರಿದ್ರು, ಹೇಗೆ ಪ್ರಾರಂಭವಾಯಿತು, ಯಾವ ಒಂದು ಉದ್ದೇಶದಿಂದ ಇದನ್ನು ಪ್ರಾರಂಭ ಮಾಡಿದ್ರು, ಅಲ್ಲಿಂದ ಹಿಡಿದು ಏನಂತಲ್ಲ ಇಲ್ಲಿಯವರೆಗೂ ಸಹ ನಮ್ಮ ಹಿರಿಯ ಸದಸ್ಯರು ಏನು ಕಷ್ಟಪಟ್ಟು ಈ ಸ್ಕೀಮ್ಗಳು ಪ್ರಾರಂಭ ಮಾಡಿದರ ಬಗ್ಗೆ ಸವಿಸ್ತಾರವಾಗಿ ನಾನು ಮತ್ತು ನನ್ನ ಸಹೋದ್ಯೋಗಿಗಳಾದ ಸೂರಜು, ಮಳೆಗೌಡ, ಮರಿಗೌಡರು ಎಲ್ಲರೂ ಪ್ರತಿಯೊಂದು ಬ್ರಾಂಚಿಗೆ ನಾವು ಹೇಳ್ತಾ ಬಂದಿದ್ದೀವಿ. ಅಲ್ಲಿಂದ ಅಪ್ಲಿಕೇಶನ್ ಫಾರ್ಮ್ಸ್ ಕೊಟ್ಟು ಬಂದಿದ್ದೀವಿ ಎಲ್ಲರಿಗೂ. 15 ದಿವಸ ಆದ ನಂತರ ಅವ್ರಿಗೆ ಮತ್ತೊಮ್ಮೆ ನಾವು ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿ ಇಮೇಲು ಮತ್ತು ವಾಟ್ಸಪ್ ಮುಖಾಂತರ ಅವ್ರಿಗೆ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಅದನ್ನು ಡಾಕ್ಟರ್ ಸೂರ್ಯರಾಜ್ ಈಸ್ ಡೂಯಿಂಗ್. And luckily, I have got a very good team this year. Secretary and other vice presidents, they are cooperating with me and all the visits. So thanks to the ASB and so the senior leaders for giving such a good team to me.
Yes,
so,
sir.
good. Dr. Anuradha Parmesh, we are doing that one. So anyone.
Sir, most for all we know, there may be many doctors who have logged in now who are not IMA members only. They are keen to know, they want to become KPPS members. They are not aware that they need to become IMA members first. To that extent, the ignorance is there on our part. And regarding record keeping, Dr. Kumar, I would like to give one message. All of us are so engrossed and so much committed in our profession that we concentrate on our diagnosis and treatment, and we fall short on the documentation. That's one thing. And the crowd also is another challenge for us. Too many patients come for some of us. So that's another challenge we'll all have to overcome.
When I visited
to be frank with you, I being anesthesiologist, okay, last month legible handwriting of the anesthesiologist. I spoke on national conference at Patna. 94% of the anesthesiologists, they do not know how to record the anesthesia notes. Patient,
Yes.
surgery was done at GA, short GA, spinal anesthesia.
That's it.
They do not know anything. I have 5 cases already in the court of law. Okay. And the judiciary reads in between the lines. Okay. And I have prepared a special format at the ISA national level, how exactly anesthesiologists should write the notes of that. Probably it will be implemented shortly in a
ಸರ್ ಎಲ್ಲ ಸರ್ಜನ್ಗಳು ತುಂಬಾ ಇದಿರಲಿ ಒಂದು ಕಿವಿ ಮಾತು ಆಲ್ವೇಸ್ ಟೇಕ್ ಪ್ರಿ ಅನಸ್ಥೀಸಿಯಾ ಎಕ್ಸಾಮಿನೇಷನ್ ಪೇಪರ್ ಫಿಲ್ಡ್ ಬೈ ದ ಅನಸ್ಥೆಟಿಸ್ಟ್. ನಂಬರ್ 2 ಸರ್ ಒಂದ್ ನಿಮಿಷ. ನಂಬರ್ 2 ಆಫ್ಟರ್ ಸರ್ಜರಿ ಲೆಟ್ ದೆಮ್ ಫಿಲ್ ಅನಸ್ಥೀಸಿಯಾ ನೋಟ್ಸ್. ಅದು ಯೂಶಲಿ ನಾವು ಸರ್ಜನ್ಗಳು ಮರ್ತೋಗ್ತೀವಿ, ಅನಸ್ಥೀಸಿಯಾ ತಪ್ಸ್ಕೊಂಡು ಹೋಗ್ಬಿಡ್ತಾರೆ. ನಾನು ಅನಸ್ಥೀಸಿಯಾ ಕೊಟ್ಟಿಲ್ಲ ಅಂದ್ರೆ ನಾವು ಮುಳುಗ್ತೀವಿ.
ಮೇಡಮ್ ಮೊನ್ನೆ ಮಡಿಕೇರಿ ಬ್ರಾಂಚ್ಗೆ ಹೋದಾಗ ಮಡಿಕೇರಿ ಬ್ರಾಂಚ್ ವಿಸಿಟ್ ಮಾಡಿದಾಗ ಅವತ್ತಿನ ದಿವಸ ಇಬ್ಬರು ಕಾರ್ಪೊರೇಟ್ ಹಾಸ್ಪಿಟಲ್ ನಾರಾಯಣ ರುದ್ರಾಲಯದಿಂದ ಅಲ್ಲೇ CME ಪ್ರೋಗ್ರಾಮ್ ಬಂದಿದ್ರು. ಅವರು CME ಪ್ರೋಗ್ರಾಮ್ಗಿಂತ ಮೊದಲು ನಾವು ನಮ್ಮ IMA ಬಗ್ಗೆ ಮತ್ತು IMA ಸ್ಕೀಮ್ಸ್ ಬಗ್ಗೆ ನಾನು ಮಾತಾಡಿ ಹೇಳಿದೆ. ಆಮೇಲೆ ಅವರು CME ಪ್ರೋಗ್ರಾಮ್ ಅದು ಆವಾಗ ಬ್ಯಾಂಕ್ವೆಟ್ನಲ್ಲಿ ಸಿಕ್ಕರು ಅವರು. ಸರ್ ಇಫ್ ಯು ಡೋಂಟ್ ಮೈಂಡ್ ಆರ್ ಯು ಎ ಮೆಂಬರ್ ಆಫ್ IMA ಅಂತ ಕೇಳಿದೆ. ಸಾರಿ ಸರ್, ವಿ ಆರ್ ನಾಟ್ ದಿ ಮೆಂಬರ್ಸ್ ಆಫ್ IMA. ಸೊ ಅಲ್ಲಿಂದ ದೇ ಡೋಂಟ್ ನೋ ಅಬೌಟ್ ದಿ IMA ಆಸ್ ವೆಲ್ ಆಸ್ IMA ಸ್ಕೀಮ್ಸ್. ಅವತ್ತು ಕೇಳಿದ ನಂತರ ಅವ್ರು ಹೇಳಿದ್ರು, ಇದರಲ್ಲಿ ಸರ್ IMAದಲ್ಲಿ ಇಷ್ಟು ಒಳ್ಳೊಳ್ಳೆ ಸ್ಕೀಮ್ಸ್ ಅದಾವ ಅಂತ ನಮಗೆ ಗೊತ್ತೇ ಇಲ್ಲ. ಇವತ್ತು ಹೋದ ನಂತರ ಡೆಫಿನೆಟ್ಲಿ ಐ ವಿಲ್ ಬಿಕಮ್ ಫಸ್ಟ್ ಮೆಂಬರ್ ಇನ್ ದಿ ಸ್ಕೀಮ್ಸ್ ಅಂತ ಇಬ್ಬರು ಹೇಳಿದ್ರು. ಬಟ್ ಐ ಡೋಂಟ್ ನೋ ವೆದರ್ ದೇ ಎನ್ರೋಲ್ಡ್.
ರೈಟ್ ಪರ್ಸನ್ ಸಿಗ್ಬೇಕು ಸರ್. ಆಮೇಲೆ ಮತ್ತೊಂದು ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಮೆಸೇಜ್ ವಿ ನೀಡ್ ಟು ಗಿವ್ ಟು ಆಲ್ ಅವರ್ ಡಾಕ್ಟರ್ಸ್ ಇಸ್ unique to Karnataka. You don't have it in other states. That's another point we have to say. I have compared. Have you compared? You can. That's another message we have to utilize. Hats off to our leaders.
Yes, sir. Yes. Encourage. Very good,
Anything?
Sir. And Chinival sir, ಈಗ ಹಾಕಿದ್ರಿ don't commit suicide. That is advice. So that will be a slogan for every doctors and every branch should be one just something like that. It will be encouraging. So
ಅವೆಲ್ಲ ನೆಗೆಟಿವ್ ಹೇಳಕ್ ಹೋಗೋದು ಬೇಡಪ್ಪ.
they should be behaved.
Just WhatsApp message.
I think Rajendra Prasad, this is altogether different topic. I think it's the time to conclude now.
Yeah.
Sir, can we go for vote of thanks?
Yeah.
Please.
Yes.
Sir, I request Dr. Indira to propose a vote of thanks. Indira madam.
Namaste everybody.
Yeah.
Namaste. I'm here audible?
Yeah, you are.
Namaste everybody. It was a very laborious but still very informative session which was very much needed. And I should thank the speakers from the bottom of my heart because they have taken the much trouble to prepare the slides and prepare every point which we need. And they should be not in a only small piece, sir. So it should be spreading over to all the doctors. We are only 100 members today, but it should reach all the doctors of the Karnataka. So that's with that motto, we shall we conclude. And I thank our Chinivalar sir, the president, who has given keen interest for everything that every activity of the IMA. And I'm really thankful for the wholehearted team which has taken the active part. And every information, every discussion was a valuable one. And this session was very successful. And I provide my vote of thanks to everybody. And this was nice talking. And this has to be spread to all over the Karnataka, to all the schemes and all the all the branches. Yes, sir. Then it should be useful for everybody, everyone, every doctor in every corner of this Karnataka. Yes, sir. Thanks a lot, sir.
Thank you, sir.
Thank you, madam. Thank you.
Thank you.
Thank you.
Good night to everyone.
Thank you.
Good night.
Good night.
Madhushankar ಅವರಿಗೆ thank you, Madhushankar sir joined, and John also, you have done a very good job. The ಎರಡು ಸ್ಪೀಕರ್ಸ್ ಗಳಿಗೆ ಎಲ್ಲ ಸ್ಲೈಡ್ಸ್ ವೆರಿ ಚೆನ್ನಾಗಿದ್ದವು. ಜಾನ್ ಅವರು ಕೂಡ ಥ್ಯಾಂಕ್ ಯು. ಅಂಡ್ ಮತ್ತೆ ಇವರು ಪ್ರಸಾದ್ ಸರ್ ಜಾಯ್ನ್ ಆಗಿದ್ರು. ಥ್ಯಾಂಕ್ ಯು. Thank you everyone.
Successful program, Dr. Suresh and Dr. Rajendra.
Hello to everyone. On 23rd, please don't miss the president's speech on 23rd at 9 p.m.
ಯಾವಾರ ಸರ್
President 23ನೇ ತಾರೀಕು ಪ್ರೆಸಿಡೆಂಟ್ ಸ್ಪೀಚ್
ಸೋಮವಾರ ನೆಕ್ಸ್ಟ್ ಕಮಿಂಗ್ ಮಂಡೇ.
Coming Monday.
Okay.
ಅಧ್ಯಕ್ಷರ ಮನದಾಳದ ಮಾತು.
Yeah, sir.
ಸೂರ್ಯರಾಜ್ ಅವರು ಲೆಟರ್ ಪ್ರಿಪೇರ್ ಮಾಡಿ ಮೊದ್ಲೇ ಕಳ್ಸ್ಬಿಟ್ರೆ ನಾವು ಇವಾಗ ಒಂದ್ ರೌಂಡ್ ನಾಳೆ ನಾಡಿದ್ದು ಮೆಸೇಜ್ ಕಳ್ಸ್ಬಿಡ್ತೀವಿ. ಆಮೇಲೆ ಡೇಟ್ ಹತ್ರ ಬಂದಾಗ ಒಂದು ನೆನಪು ಮಾಡ್ತೀವಿ.
ಅವತ್ತು ಕೂಡ ನಾವು ಆಕ್ಟಿವ್ ಆಗಿ ಜಾಯ್ನ್ ಆಗ್ತೀವಿ.
ನಾವೆಲ್ಲ ಆಗ್ತೀವಿ. We want more people to join.
Sir, I'll close the end. I'll end the meeting, sir. No?
Yeah, Veerabhadra sir,